focused on COVID-19 testing in Wisconsin. This is being aired live on YouTube. And joining us for this briefing are DHS Deputy Secretary Julie Willems Van Dijk and our testing experts, Major Russell Simonis with the Wisconsin National Guard. He is the officer in charge of the Specimen Collection Action Team. And Svea Erlandson with DHS. She is the civilian lead of COVID-19 Specimen Collection Action Team, and all are able to answer your testing questions today. We will begin the briefing with remarks from DHS Deputy Secretary Julie Willems Van Dijk.
Thank you, Elizabeth, and thank you all for joining us today. We're in a tough spot, Wisconsin. We're adding 4,870 more confirmed cases of COVID-19 today, which brings our total to 214,996. 70 out of 72 counties in our state are at the very high COVID-19 disease activity level. Our hospital capacity is strained. Yesterday, 1 in 5 Wisconsin hospitals reported a critical staffing shortage. This past week, we saw a 16% increase in COVID-19 hospitalizations over the week before. We continue to accept patients into our alternative care facility, and the number of COVID-19 patients in our intensive care units across the state continues to grow. And it's had tragic results. As of today, 1,948 people have lost their lives to COVID-19 in Wisconsin. Our hearts go out to the family and friends who lost loved ones to this virus. COVID-19 is in every corner of our state, which means we also need the resources to stop its spread in every corner of our state too. One of our key tools is testing, and that is why we are expanding access to COVID-19 testing in Wisconsin. Through December 10th, free community testing sites will be open in 71 locations across the state. Every location will use our COVID Connect online registration and results system, and people will receive their results by email or by phone. The operating hours of each location are unique, so the best plan is to visit the testing page of the DHS website to check when the location near you is open and whether or not it is drive-through, walk-in, or if you need to make an appointment. Making these community testing sites a reality has been an incredible team effort. DHS, the Wisconsin National Guard, the State Emergency Operations Center, local and tribal public health, county and tribal emergency management, and Healthcare Emergency Readiness Coalition coordinators have all worked together to make this happen for the residents of Wisconsin, and we owe them a deep debt of gratitude. We've learned so much throughout this pandemic. With each new day, we've learned more about the virus, where it is in our state, who it is affecting most, and how best to stop the spread. It's a humbling experience to learn as you go when the stakes are this high, and that is why having partners like the Wisconsin National Guard and our local and tribal health departments has been so important. We've all learned together, and our collaboration has strengthened Wisconsin's response. And it's why we need everyone in Wisconsin to partner with us too. We know what works, and we need to put that knowledge to use as a state. Wearing a mask works, and it works best when every one of us does it. Staying 6 feet apart, physical distancing works, and it works best when we all do it and we do it consistently. Staying home as much as possible, limiting your trips to the essentials and avoiding gatherings works. And it works best when we all do it. And of course, don't forget to wash your hands frequently. And please, 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 if you have symptoms or have been in close contact with someone who has tested positive for COVID-19, get tested. But testing is only the beginning. Remember to stay home and isolate from the people you live with while you wait for your test results, and continue to do so if you test positive until 10 days have passed and you have no further symptoms. And please help our contact tracers if you test positive by notifying your contacts and asking them to quarantine at home for 14 days. Getting tested and isolating works. Quarantining if you have been a close contact to someone with COVID-19 works. And all of these actions, staying home and wearing masks and physical distancing and washing your hands, they all work best when we all do all of them consistently. We are in a tough spot, but we can get out of it by doing what we know works. Thank you, and I'll turn it back to you. I think I'll turn it to Major Simonis, who has some remarks as well.
Well, good afternoon, everyone. As Elizabeth mentioned during the introduction, I'm Major Russ Simonis, and I'm the Wisconsin National Guard lead for the Specimen Collection Action Team. Our team is responsible for coordinating, planning, and managing COVID-19 testing at the state level. And I co-lead that team with Savera Erlinson from Department of Health Services, who I believe will be introducing herself here shortly. But the Wisconsin National Guard, we've collected over 725,000 specimens statewide since mass community testing began this spring. And we look forward to continuing to offer this testing to our fellow neighbors across Wisconsin, and we'll continue to support when called. Thank you for your time this afternoon, and I look forward to taking any questions. Thank you.
All right, thank you. And we will now take your questions. So a reminder to maintain audio quality, remain muted until it's time to ask your question. If you are on the phone and you are able to do so, please use *6 to mute and unmute yourself. And we will begin with Courtney Terlecki from WAOW in Wausau. Courtney.
Hi, thank you for taking my call. This is actually for the Deputy Secretary. I had a question about COVID and schools. We're about 2 months into the school year here in Wisconsin, and I'm in the central Wisconsin area. We only had one district go virtual. The rest have pretty much been in person, and we're seeing that the numbers for COVID appear relatively the same. I'm curious if there's been any studies yet into the difference, or if there's any data to support outbreaks related to schools or not.
I'm not aware of any specific studies, Courtney. What we do know is that many of our school districts have taken important precautions to protect children and to protect staff. The Department of Public Instruction and the Department of Health Services worked together over the summer to provide that type of guidance in documents we've shared with districts across the state. And so schools are a special place, and they're a place where the staff, the teachers, and the principals can make the rules and enforce things like physical distancing and wearing masks and all of those important things that help protect children in those settings. We know, and I don't have the number right in front of me, but we know we've had a number of outbreaks in school settings across the state. Although most of them have been limited to a fairly small number of children or staff. And again, I think this speaks to the good precautions that schools are taking. We've also heard stories where students are being asked to go home because they're ill, and they've had problems getting access to a test. And so I think what we're talking about here today is really helpful in that one of the things that will protect further spread in schools is for children and staff members who are ill to stay home and to get a test to understand if they are ill from COVID. And my hope is that our regional testing that is expanded across the state will make that easier for parents and staff.
All right, thank you so much for that. And we will now go to Lane Kimball from News 3 in Madison. Lane, do you have a question for our testing experts? Lane Kimball, News 3. All right, let's move down the list to Todd Richmond with the Associated Press. Todd, are you on the call with us?
Hi, can you hear me? Can anyone hear me?
Yes, we can hear you. Is this Todd?
Yes, it's Todd. Thanks for holding another one this week. Two questions wrapped into one here. So we have 71 more sites. That's in addition to how many are we operating right now? And how much pressure is that going to put on contact tracers where already they can't keep up?
Svea or Major Simonis, you want to answer the question about the sites, and I'll be happy to answer the question about contact tracing.
Absolutely, I can take that one. So the 71 sites are in addition to 3 enduring sites that we continue to operate. Those 3 sites are in Dane County, Milwaukee County, and Winnebago County. So there are 74 sites currently operating under the community testing model.
And yes, Todd, we understand that more testing creates more work for contact tracing. We continue to work on building our contact tracing resources throughout the state. And we are also working to message what contact tracers tell people when they call. So it is important, if you get a positive test, that you stay home and isolate from others in your household, and certainly others outside of your household until you are symptom-free for at least 3 days. And it is important that you notify the people who have been close contacts to you that they are a contact to COVID-19, that they should stay home for 14 days, and that they should get a test. Our contact tracers and disease investigators continue to follow up, but we know it's so important for people to take these actions right away. And so we're working on making sure everybody knows what they need to do. And that includes at our testing sites, letting people know through the notification we make to them when they do have a positive test, what the next steps are that they should do. So we continue to work on expanding contact tracing resources, and we continue to expand the messages to people so they know what to do if they don't get contacted right away.
Right, you're wonderful. Let's go now to our next question, and Sean Kirkby from Wisconsin Health News. Sean Kirkby.
Hi, thank you for holding this. I was wondering for the staffing of these sites, can you elaborate on how they'll be staffed, how many National Guard members will be utilized to run them? Thank you.
Major Simonis?
All right, thank you for that question.
Oh, I think you're on mute.
Try that again. Can you hear me now okay?
Yes.
All right, so generally with most of our community-based testing sites, we've transitioned to what we call a squad-based model. And generally those sites are going to be staffed with 10 to 12 Wisconsin National Guard members on average. And those sites are generally collecting anywhere from 300 to 450 specimens per given testing day, which will range anywhere from 6 to 8 hours. There's been a little bit of a shift to things, how we've done testing previously, where we were coming in with larger teams and generally, maybe 25 to 30 members. So consolidating, I should say, breaking down those larger teams into smaller squad size elements has allowed us to better support the state, just because we can reach out to more communities on any given day, recognizing that the testing demand in a lot of communities doesn't exceed that 300 to 450 test benchmark. In areas that it does, those are where we're configuring our teams appropriately to just ensure we can meet that demand in those localities if that demand is a little bit higher.
Thank you, Major. Let's go now to Denise Lockwood with the Racine County Eye. Denise Lockwood. All right, moving down to Ben Jordan from TMJ4 in Milwaukee. Ben Jordan.
Hi there. Thank you for taking my call. I have a question about a report the CDC just put out about an outbreak at an overnight summer school retreat dating back to July through early August. It looks like the National Guard responded along with DHS. The CDC is saying this started with one person and ultimately spread to 116 students at this camp who weren't adhering to social distancing or mask wearing. Could you tell us a little bit more about this investigation, where it happened, and how the virus spread was contained at this particular location?
I don't have the specifics of that particular investigation, but what I can share with you is that doesn't surprise me. COVID-19 spreads like wildfire, and when you bring a lot of people together in a relatively small space and at a summer camp, you know, I've been to summer camp and I know, you know, we put a whole bunch of people in a dormitory-like setting, you know, sleeping in bunk beds or cots close together. And if there was one person who was ill with COVID-19, they easily spread that to everyone in their housing unit. And then by the nature of summer camp, where you eat meals together, go swimming together, do activities together, sing around the campfire together, all of those activities are great spreading events for COVID-19. So that's how it would go from one person to over 100 people in a very short period of time. And that is why we are encouraging people to religiously follow the kinds of guidance that we are talking about. Keep your social circle small, wear masks, keep 6 feet of distance from each other, and that is why it is so important. This incident is a great illustration of why we need to do all of those things.
Thank you for that. And Ben, we will follow up with you after this call as well. And now we'll move on to Danny Maxwell, WKOW. Danny, do you have a question for our testing experts?
Yes, I do, and I was going to ask about testing demand, and so I'm very glad that we kind of addressed that a little bit before, but we have a community testing site in our area that is way above the 300 or so that was mentioned already today, and the last 2 weeks have run out of their allotted tests, and it had to close early because they ran out, which they think is going to happen again today. So I'm wondering how those tests are distributed and allotted, and with these new testing sites opening soon, will that help alleviate some of the long lines because right now there are fewer test sites? How do you really ensure that each site gets the test needed to meet the demand that they have? Thank you.
Svea, you want to talk to that?
I definitely can. So first of all, I just want to say that we are incredibly glad to see the amount of Wisconsinites that are coming to these sites and accessing testing, having greater access, and really using the resource that's out there. In terms of meeting the demand, we've been using planning factors in conjunction with the Wisconsin National Guard to prepare these sites. As we've seen throughout this response, the National Guard is fantastic at specimen collection and continues to process specimens at an even faster rate, which is getting us to this point at a few different sites of essentially meeting that capacity before their 8-hour testing day is complete. So we're continuing to manage these conversations about test supplies to sites, but also want to maintain the balance of work-rest cycles for our service members, and just continuing to meet the demand across the state in the best ways possible. So the conversations are ongoing, working towards further strategies to meet that demand, and hope to have more on that shortly.
Svea, thank you. The next question now, Mitchell Schmidt, Wisconsin State Journal. Mitch Schmidt.
Yeah, thank you very much for the call today. I was wondering, with regard to the testing and contact tracing that has been taking place, I was wondering if you could talk a little bit about, is there any sort of trends that we're seeing? Is this primarily happening at super spreader events, small gatherings, workplaces, or is it kind of a matter of maybe all of the above at this point? Thank you.
Thanks, Mitchell. I can take that question. I think the answer, in truth, is all of the above. But one of the things that I understand from having spoken with a number of our contact tracers and in conversations with local health departments is that they're seeing many incidences where the likely source of exposure was smaller gatherings. It's birthday parties. It was backyard barbecues when the weather was nicer. It's Packer games. And one of the things I want to say about testing is that going to one of our testing sites and getting a negative test is not a ticket to go to the Packer party or to the bar or to any other large gathering. What that test means is that you're negative right now at the moment you had the test. The minute you drive out of the testing site and go be exposed to other people, you could be exposed to COVID-19. And so it doesn't provide you any protection to have a negative test. It simply provides you with information that at the day you had that test, at the time you had that test, you were negative. But you still need to leave and take all of the proper precautions that we've been talking about in order for us to reduce this spread. And I know I've also talked to many people who are like, yeah, went and got tested, was negative, so I went to see my grandparents. And I know we all want to see our grandparents. I am a grandparent. I want to see my grandchildren. But we have got to be cautious about this and not be using a test as a ticket to just go get together and ignore masking and physical distancing and keeping our social circles small. We still need to do all of those things.
Great advice for that. Thank you. And Katrina Nickel, you are next on the list, WLUK in Green Bay. Katrina? Katrina Nickel? All right, Stephanie Hoff. Oh, Katrina, are you there? Yes.
Yes, I am. Sorry. Sorry about that. My question is, where's the funding for these new community testing sites that are opening coming? Where's the supplies coming from? And I know we kind of touched on it, but again, is supply an issue because we're hearing some anecdotes of sites running out of tests?
Yeah. The funding for this entire operation is coming from the CARES Act, the federal funding to support COVID-19. In terms of the supplies, as Savea has said earlier, we definitely have adequate supplies, and it is both a supply and test kit issue and then a people power issue because we can only do so many tests in a day. And as Savea has said, we are redistributing supplies as we learn more about the activity level at each test site. There are plenty of tests. We are working with a number of different diagnostic labs, and they have all been fabulous and have been working with us to increase their ability to process more tests. Every one of the labs we are working with has increased their supply to the state of Wisconsin. They also deserve a great shout out, and I'm going to list them. We're working with Exact Sciences, Accelerated Labs, NOAA Labs, those are all Wisconsin-based labs, Molecular Laboratories, Fulgent Labs, and Mako Labs. Those are out-of-state providers. So we've expanded the number of labs that we're working with, and they have been incredibly responsive to us. And they've also worked very hard to keep their testing turnaround times within 48 hours for these important PCR tests, which is also critical to our response. So there is funding. There's funding for more tests. It's about titrating the number of tests to the demand. And our team's been doing a great job.
All right, thank you, Julie. Thank you, Katrina. The next question, Stephanie Hoff, WIS Politics. Stephanie Hoff.
Hi, thanks for holding this today. My question is so the National Guard has other pop-up sites that they do. Will those continue?
Major Simonis?
Yes, that is correct. Right now, all our sites continue to be operational. We don't. There are no sites that are ending, if you will. There are a couple sites in the Dane and Milwaukee County that are going through some transition, but all these pop-up sites that you see across, all 72 counties, and as well as the 11 tribal nations, they're going to remain operational. So.
For that, the next question, John Neisser, NBC 26. John.
All right, thanks much for the call today. Just wanted to see if there was an update on the deployment of the rapid tests that were made available from the federal government. Can you kind of provide an update on where those have ended up and how they're being used?
Absolutely. I can take that question. I know there have been recent press releases saying Wisconsin is receiving 1.7 million of the Binax Now rapid tests. We've received so far a little over 1 million of those tests and anticipate receiving the additional 700,000 on a weekly basis throughout the remainder of the year. 600,000 of those tests have gone directly from the federal government to long-term care facilities across our state, to nursing homes and assisted living centers. We've been working with those facilities to understand the appropriate way to administer those tests and to provide the appropriate medical support through standing orders for them to be able to conduct those tests in their settings. The remaining 400,000 plus have been distributed to healthcare systems throughout our state as we see that they are experiencing the surges they are. Our health systems are using those tests for symptomatic patients and for their own healthcare workforce. We know many healthcare systems are having staffing issues, not just because they have more patients, but because their workers are also falling ill to this disease or are contacts to this disease. And so by using these tests and testing healthcare workers regularly, they are in a position that they can get workers who may be in quarantine back into the workforce sooner. So that's where they're going now as we continue to, we also heard the invitation to ask for additional tests, which we are doing, and we'll be looking at expanding other populations that could benefit from these rapid point of care tests. Thanks for the question.
Thank you. The next question, Taryn Powell, WUWM Milwaukee. Taryn Powell. And a reminder, *6 will mute and unmute your phone. Taryn Powell.
Can you hear me?
Yes, go ahead.
Okay, sorry about that. Thank you for the call. As we're talking about healthcare systems kind of being strained, both with like ICU beds and staffs, I'm wondering how much the state, like how much longer Wisconsin hospitals and like the alternate care facility can like hang on. Is there like an estimate before we're like, okay, we can't take this anymore?
Well, we certainly are all looking at the data, and that is why you are hearing such urgent pleas from us that we have got to turn this curve, or we do run the risk of exactly what you're speaking of, Taryn, is running out of hospital beds. I know today in the Milwaukee area, there are hospital system leaders who are making that urgent plea to people as well. And I just encourage every Wisconsinite to understand that for a period of time, we are going to have to be even more strict about our social interactions, our physical distancing, our mask wearing, and really only leave your home if you absolutely have to. In terms of preparing for this surge, there are a number of different lines of effort underway, both within hospitals and health systems and within the state to help support them. We've made a number of regulatory changes, allowances to help people, for example, who have a recently lapsed healthcare license to be able to reactivate and work again, to allow people from out of state to come into our state to work. We are working on training programs and helping mobilize certified nursing assistants for our long-term care facilities. Health systems throughout the state are working on standing up surge beds within their hospitals for additional patients. Hospitals across the state are also working with each other. If my hospital is full and your hospital has beds, transferring patients back and forth. And then, of course, finally, we have the alternate care facility in Milwaukee that has begun to see patients on a regular basis. Today, they're at 7 patients, but I want to remind us all the facility has the capacity to go up to 500 patients. And let's hope we don't face that, you know, we didn't ever want to open the alternate care facility, but we're very happy that we all had the foresight to see it may be needed. We made the investment to create it, and it is now there to serve as that safety valve for hospitals across the state.
All right, thank you for that. And we go now to Mark Stevens at CBS 58 in Milwaukee. Mark.
What happens in December when this funding runs out to these testing sites?
It's a great question, Mark. We're planning for that. The federal, as you know, the Congress has been talking about additional COVID relief, and we want them to continue to talk and actually to pass legislation so that there are dollars available to continue this important testing outreach. In the meantime, we continue to conduct planning efforts around how we can continue testing in the absence of federal dollars.
All right, the next question to Madeline Anderson, Fox 6. Madeline Anderson.
Hello. You, Deputy Secretary Willems, had mentioned early on in the call that 1 in 5 hospitals reported yesterday a critical staffing shortage. Could you just go into a little more detail about what a critical staffing shortage means, how serious this is, how many staff are hospitals short, those kind of details? Thank you.
Yeah, I don't have those kind of details directly in front of me. We do a daily survey and ask hospitals that question, and they have certain standards they use to determine that. But I think what it means is what happens, having worked in a hospital myself, is when you're on critical staffing shortages, what it means is everybody has to step up and work a lot harder when they're already working very hard as it is. It means people work double shifts. It means people come in on their day off. It means people take more patients than they normally do in a patient care setting. And those are all things that are hard on patients and hard on staff. And I just have to stop for a moment as we're thinking about hospitals, because I know a lot of people talk about how uncomfortable it is to wear a face covering, as we are. But I want us to think about that nurse who's working in that hospital, who's working now, not an 8-hour shift, but a 16-hour shift because there weren't enough people to come in on the next shift. She's wearing an N95 that is like glued to his or her face, wearing a face shield, wearing an extra protective gown, wearing gloves all day, 16 hours, coming home with skin macerated around that was underneath that mask for 16 hours. All that time away from their family, on their feet, taking care of people who are alone, who are having problems breathing, and who are often taking their last breaths without their family. This is what we're talking about when we say we have a critical staffing shortage. And this is why we need the people of Wisconsin to join with us and take this extremely seriously.
Thank you, Deputy Secretary. An important message to get out. Let's go now to Dan Malloy, Spectrum News 1. Dan.
Hi, everyone. Just a question for the Deputy Secretary. You just touched on it a little bit, as you did earlier, talking about families. Throughout this pandemic, we've asked about gatherings, whether it's St. Patrick's Day, Memorial Day, Labor Day, 4th of July, et cetera. We've got Halloween this weekend, Thanksgiving, and the winter holidays coming up not long after that. What is the messaging DHS needs Wisconsinites to hear about people who have been really hoping to see their families sometime soon in relation to this crisis? I mean, how much worse can it get if people do decide that they're not going to follow some of these measures?
Yeah. Thanks, Dan. These are very tough questions. We all have holiday traditions, and I know it is very hard to think about alterations in those holiday traditions. And the virus doesn't care. The virus is going to spread the way the virus spreads, whether it's Halloween or Thanksgiving or Christmas, as it has throughout this. We've seen surges after Memorial Day. We've seen surges after the 4th of July. And it would be very challenging for us to have a surge on top of the surge that we're having right now. And so I think the other thing, I know many of you have read or have heard stories of people who thought, oh, it's just going to be okay. My family's okay. We're not going to have this. And then the tragedy of someone infecting a grandparent, an aunt, an uncle, and then feeling the guilt of perhaps being the person that gave them the disease that lost their life. And so we want to have wonderful holidays in the future. We want everyone to be there. And so I don't think this is the year for huge family gatherings. Again, every family has to make their own choices, but to be safest, it is best to celebrate with the people that you live with or are in your immediate family. It is best to keep masks on the whole time if you choose to celebrate with anyone outside of your immediate family, to keep 6 feet of distance. It is also best to celebrate outside. And that's a lot easier for people who live in Texas and Florida to do at Thanksgiving and Christmas than it is for people in Wisconsin. Being inside definitely increases the risk of this. Air does not circulate as freely in indoor spaces as it does in outdoor spaces. And so a long, prolonged holiday gathering with a lot of people in a house without masks and without physical distancing is a perfect petri dish for COVID-19. And remember, we say stay home if you have symptoms, but the challenge of this disease, it is a silent spreader. And people, even without symptoms, can be spreading it. And so you can't even go and be guaranteed if I feel okay, I'm going to be okay. So those are the really hard facts that I think every family needs to have a very frank discussion about as they enter this holiday time and think about what they're going to do over these important times in the next few months. I just really encourage people to think seriously about this and to be creative and think about other ways they might be able to join with each other. Really just hope people can have those, what I know are really tough conversations, and make the safest choices they can.
All right, we'll go to our next question. Lane Kimball, News 3. Lane Kimball, are you on the call? Again, a *6 will mute or unmute your phone. Lane Kimball. Or Denise Lockwood, Racine County Eye. Denise Lockwood.
Yeah, thanks for taking my call, or my question. I wanted to understand around, a lot of the jails are now starting to see some pretty big outbreaks, and what that means to the community at large that these jails are in, and how the response is coming together with regards to testing.
Yeah, let me just speak to the jails and the risk, and then Major Simonis, maybe you can talk about the guards' role in assisting with testing in correctional facilities. So again, jails are a lot. The situation in a correctional facility is not that different than the situation I described earlier at a summer camp. You have a lot of people who are living very closely together, and as disease rates go up within a community, people who are newly coming into that jail or that correctional facility may be bringing the disease with them, and so might the staff be. And so we've been working very closely here at the state with our Department of Corrections, and I know the counties have been working very closely within their county jails to think about what are the things that they can do to protect the people in their care. And that includes things like symptom screening for staff coming in, requiring staff to wear masks, again, being vigilant about staff who are ill staying home, and testing of those staff and people in their care when symptoms or identified cases are identified, and then doing their very best to implement isolation or quarantine within the facility. But Major Simonis, can you talk about the wing's efforts in correctional facilities?
Yeah, absolutely, and thank you for that question. So we've been actively testing and supporting testing within Department of Corrections facilities, as well as county jails and other type of detention facilities since very early on in this mission. And we've essentially built a sustainable process where I personally meet with Department of Corrections leadership every Monday. Savannah Erlinson from DHS is also part of that call, so we have joint representation from both agencies to hear the most recent needs from Department of Corrections officials in terms of where their assessment is of where they need testing most. And what we do as an organization is we allocate a certain amount of our wing forces and testing capacity towards that testing, that DOC testing or jail testing in jails, and even DHS facilities for any given week. So it's a week by week assessment. Often some of the outbreak type situations that happen in some of these larger facilities, we have to react a little bit more quickly to, rather than waiting for that next Monday meeting. But it's something that we've actively participated in since the start of the mission. And like many other parts of this response, it's just a continuous assessment of where the need is needed most. So.
Right. Thank you for that, Major Simonis. DHS Deputy Secretary Julie Willems Van Dijk, Svea Erlinson, we appreciate your time. Reporters, we appreciate all of you calling in. For now, please continue to monitor the DHS COVID-19 web pages for our data, for our guidance. You can find additional information on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.